I did see a fair few runners just because everyone runs, but I think the interest kind of peaked seeing the crazy things that they will do. People hear about shin splints and they'll just start attributing everything to shin splints, or if they have foot pain, they'll just think their shoes are the wrong shoes.
What is a stress fracture?
A stress fracture is...
Hey, I'm Zeb.
And I'm Maddie.
And welcome to the We Don't Know Yet podcast. Whilst both Maddie and I are healthcare practitioners, we understand that there's no one-size-fits-all approach to healthcare. Should you require any medical attention, please seek out your local healthcare practitioner.
We are joined today by a very special guest. Beau, I might hand over to you to, I guess, give a bit more of an intro about who you are and what you do, because I feel like you're going to do it way more justice. And I sound very nasally still from last week, so apologies.
No, all good, all good. I'm Beau, obviously.
Hi, Beau.
Hi, Beau.
I'm a physiotherapist out in the east. I work at a clinic called the Running Room. And I primarily treat runners there. And a big part of treating runners is bone stress injuries or stress fractures.
Mm-hmm.
I kind of come from a background actually not of running. I don't personally run very much, and I much more preferred covering rugby and different contact sports earlier on in my career. But I kind of have taken a lot of the, what I would call like higher standards, like sports physio, into the running space and just applied it to what is quite a scary and complex injury. And it's just been really fun. I've actually really enjoyed treating runners for the crazy people that they can be.
Yeah, amazing. I'm really interested to hear, I guess, about your background more so and how you got into that as a non-runner.
Yeah. Well, I was covering like the junior Rabbitohs and a few shoot shield teams in rugby. And I was the head of the female Gordon rugby team, and we had bone stress injuries out the wazoo. So I was exposed to them. Yeah, women's sport, unfortunately, is just subject to a lot of bone stress and stress fractures. And I was working at a clinic called iMove Physiotherapy.
Yep.
And they asked me if I wanted to go over to one of their partner clinics at the Running Room. And I said, yeah, why not? And initially I moved over there and I was like, oh, runners are, it's so different. They're so insane. The things that they do and how much they push, we were kind of talking about it off air. They just go way too hard, too easily.
Yeah.
And the things they'll push through is kind of unreal. So started working there part-time and then kicked over to full-time there recently, which has been good.
Yeah, great. How long have you been there for?
I've been at the Running Room now for over a year.
Yep.
Yeah. And I moved for almost 2.
Oh, cool. And what led you down, I guess, the path of physiotherapy as a whole?
That's such a good question. When I was finishing high school, I really had no clue what I wanted to do. I enjoyed science. I enjoyed sport. I always liked to talk smack in class. And I didn't really know what I wanted to do. And I was thinking about doing engineering or something more science-based. And I was like, what's the perfect thing for me? Would just be chatting to people all day and doing sport and doing science. So I just basically said, physio sounds like all of that, and wound up here.
Yeah, amazing.
Didn't look back. It was good.
Seb, I feel like you're very similar. Like you love your job partly because you get to chat shit every day.
Oh, yeah. I think it just comes with being a chatty person. You know, a lot of us physios, osteos, chiros, you end up being in the space just because you like talking to people.
Yeah, 100%. I can chat too much shit, honestly.
That's so good. And where did you rather go to uni?
I went to the University of Sydney.
Yep.
Out at Lidcombe. Shout out to Lidcombe campus.
Shout out to Lidcombe.
Yeah, it's like you go to the main campus in Sydney and Camperdown, and it's like so professional, so serious. It was literally like a primary school out at Lidcombe.
Yeah.
Everyone would rock up in like Crocs and their pajamas and stuff. Like, it was so much
very
more laid
different
back.
university environment.
So different. Yeah,
That's great.
No
though.
legal people judging you, just all the sports fids kids having fun.
Oh, honestly, I can relate though. In Melbourne, I went to RMIT, but I went to the Bundoora campus in Melbourne. So there's the city RMIT campus, and then there's the Bundoora campus, which has all the sporting fields.
Yeah.
It has all like the kind of science-based, like sports orientated degrees there, and everyone just rocks up in activewear. It's just an activewear place.
Oh, so much more chill.
We'd like to take a break from today's episode to give a quick shout out to our sponsors, Drip Digital. They manage all of our audio and video editing as well as our social media marketing. Without them, the We Don't Know Yet podcast wouldn't be possible. So thank you again. I love that. That's so good. Yeah. I mean, I went to a pretty chill uni, like people just riding on skateboards and walking up barefoot and things like that. But yeah, maybe not as casual as you guys. Yeah,
That sounds pretty casual.
Barefoot's
very
pretty cash. That's
Yeah,
pretty
like,
out there.
that's another level.
Actually, to be fair, I used to go to exams in my pajamas because it was like the middle of winter. I was like, fuck it, I'll just rock up in my PJs.
Yeah, we're focused on other things during exams, man.
Exactly.
Yeah.
Appearance is not one of them.
No, shouldn't be.
Yeah. And so has your interest in running kind of sparked with the whole running phenomenon that came around mid-COVID? Because I feel like
Everyone's in their running era.
that's where it was a big thing. And we've spoken to a few guests on here, being Chapo, Luke, even Izzy, about the fact that all of a sudden everyone seems to be running.
Yeah, well, no, I wasn't particularly interested until I started working with them more. I did see a fair few runners just because everyone runs, but I think the interest kind of peaked seeing the crazy things that they all do. Like the part of physio that I probably most enjoy other than chatting shit is seeing weird, wacky injuries and learning and working out how to help people through something that I feel could be very easy to mess up, like when the stakes are a bit higher.
Yeah.
And just seeing what the people are capable of doing to themselves in such a simple sport like just running, and how much you can help them with something that might be quite serious is pretty cool.
Yeah. And I guess that is why you're here today. Obviously, we are chatting all things stress fractures. Well, not all things, high level stress fractures. And that is something I feel like, and again, we're talking off air about it, that people often just push through, not really realizing the seriousness of what they're experiencing.
Yeah. I think people hear about shin splints and they'll just start attributing everything to shin splints, or if they have foot pain, they'll just think their shoes are the wrong shoes or they're too tight. And people get kind of caught up into... And I think it's even true with physios. Like I know when I first started as a physio, I didn't know much about stress fractures or what to look for or anything like that. And it's just a real lack of awareness. And people will just attribute it to what they know. And often that can be pretty problematic when your shin's broken or your foot's broken and you keep going.
Yeah, and I think as well the complexity kind of goes on from the fact that we in the allied healthcare space kind of still take a little bit of time to formulate a proper clinical diagnosis. It's never patient in the door, first session, you know exactly what's going on with the patient straight away from the get-go. You kind of have to do a little bit of detective work.
Definitely. And even when you start to work out what it could be, you don't always work out why, or you don't work out how you can prevent it again. That just takes time. And I think we're pretty lucky in that we get to see patients a fair amount in the private sector. We just get to spend the time to work those things out with them.
Yeah, awesome. And that patient, client-patient, what's the word? Not client-patient.
Patient-practitioner rapport.
Yeah, that one.
Yeah.
Patient, too many P words for a congested nose. Yeah, it's so important though. And again, you don't want to throw out a wonky diagnosis, have them freaking out and go, oh, actually, sorry, I was wrong.
Yeah. Oh, I love being wrong. When I think it's a stress injury and I send them for a scan, it comes back, I'm like, thank God.
Yeah.
Whew, you are
We
so
dodged it there.
Yeah, exactly.
So if we were to strip it right back for anyone listening that doesn't even really know what a stress fracture is, what is a stress fracture?
A stress fracture is basically an overuse injury of your bone. You've taken any tissue and you've just loaded it and loaded and loaded it to the point where it's actually breaking. So a stress fracture does exist on a continuum. You have normal bones and then you overload them too much. They start getting weaker. They start being sore. And then you load them even more and they'll start to break down a lot to the point where you literally can completely break pretty much any bone in your body by running or doing any activity too much.
Yeah. And I think as well, it's not very common knowledge that bone is constantly repairing itself. I think people just think your bone is set, it's strong, it doesn't, it's not muscle tissue where you go to the gym, you work out, you tear the muscle repairs and you get stronger. Yeah. People think bone is just bone. That's it.
Yeah.
There's no remodeling or anything.
No, it's not a static tissue at all. It's always kind of going through processes of change. And sometimes those processes are really quick, particularly if bones getting weaker can happen very quickly. But bones getting stronger takes an exorbitant amount of time. And that's probably the crux of the issue. Once you overload bone, it's going to take weeks and weeks and months for it to get back to normal.
Yeah.
And you can just keep going throughout that period and overloading it even more.
And causing more damage.
Yeah, and it's really a negative feedback loop. If you imagine just a twig, if you start bending a twig and it's starting to break, it's going to be easier and easier and easier for it to break every time you bend it.
Yeah.
It's not going to be as strong as it was when you first started bending it.
That's a good analogy. I like that.
Yeah, I do really like. I've never thought about it like that.
Yeah, it's probably one of the only tissues where you can snowball really quickly into like a break.
Yeah.
I always think about, bit off topic, but kind of not, those old people that are proper 90 degrees. I'm like, that must have taken so much time to like.
Their bone just get worn away and degenerate a little bit over
Yeah,
time.
exactly.
Scary.
Yeah,
My nan's always into me about posture.
Yeah, well, I think as well, like people, like you said, it's a continuum. People don't really understand that continuum very well. So maybe let's like break down what that continuum actually looks like, because there's different grades and different kind of like steps into getting to the end stage. If you are brave enough to progress it all the way to the fracture.
Let's not say brave.
Yeah, let's say stupid enough to progress it.
What I would probably say is there's normal bone, and before we go into how you get to a stress fracture, there's kind of the other end of it, which would be osteoporosis or osteopenia. Because if you actually unload a bone for long enough, or you're not fueling properly, your bones can get a lot weaker. So you can go both ways. You can't, if you go completely away from loading your bone, it'll get weaker too. But generally you'll have healthy bone, and as you start to load it, you'll start to get what we call like low-grade inflammation around the bone, either on the inside or the outside. And that's just reflective of the bone starting to break down and release more chemicals. As you push that further, that swelling and those chemical signs will increase. And that's when you're going up the scale towards that whole period where there's inflammation is called a stress reaction. So that's like a lower grade bone stress.
Right.
And as you push down that scale, your bone is still weakening because you are loading it, but it's not going to show up until it's really drastic and the bone is drastically impaired. And that's when it starts to show up on scans as a crack, mostly on MRI, but sometimes on X-ray as well. And when you do start to see that crack, it's a stress fracture because the bone is fractured and broken.
Around that stress reaction phase, will someone, I guess it would be so case by case, but would you typically expect someone to be experiencing pain?
A lot of the time, yeah. And that's actually like a good thing to call out. If you're getting pain early on in the stages, it's hard for you to get to a stress fracture. The patients that get pain at grade 1 or 2 or 3, and it's quite bad, it will limit them so they can't keep pushing as much. Versus the people that are getting only symptoms as they get to the higher grades, it's easy for them to break their bones. And that's where that case-by-case basis really comes in. But generally in the lower grades, it's not really as exaggerated symptoms. You're not getting really sharp pain like your bone is breaking. You're kind of getting more like a diffuse ache that's prolonged. And that's why people miss them. Like physios will miss them, other healthcare practitioners will miss them because they're looking for those kind of cardinal signs of a fracture. But really, because it is on that continuum, it's much more subtle early on.
And also a lot of the time we miss it because of the fact, I think today's day and age, we're deterred from sending for scans regularly. It's a big thing in the healthcare industry at the minute that we don't want to overscan the population or like make people really concerned about, like things that might be underneath the layers of the skin that we can't actually see visually. So like not sending people for a scan on the premise that you're kind of like, like they got a little bit of an ache. There's no real like telltale sign that there's a fracture or anything there. I'm probably not going to send them for a scan today. That's like one of the big kind of...
Everyone's scared to be wrong as well. I think we mentioned that. And I think in the situation where you might be having a bone that's breaking, and the consequences to that can be really dire, it's kind of like if you thought someone tore their ACL, you would always send them for an MRI.
Don't muck around.
You don't muck around. And I think that should be the same for bone stress injuries. As soon as you start being concerned, it's very urgent to get it done because they're going to take ages to recover. And if they do anything wrong in that period, it's going to be much harder.
Yeah. And I think you learn very quickly as well, just from the perspective of a lot of the time you get really concerned about people's like funds and their money and sending them for a scan that's worth like $250 and they're kind of sitting there going, I really need this scan. You kind of sit there and go, yeah, but do you really need 6 months of like, physio we can kind of stick it in the butt now?
Yeah. If you push it to the point where you're going to be in a boot seeing me all the time, it's going to end up being a lot more than $300. Or if you, again, take it to a really extreme point, you need to see a specialist. You need to go get endo and dietitian review and potentially sports psych as well, because it's just pushed so far. Like all of those things end up being much more expensive. And I also think the cost to you personally, not being able to walk around normally, not being able to, do the things that you love, and then like the mental impacts and quality of life impacts for that. I'd pay $300 to know that I'm not going to make that mistake any day.
Oh, for sure. When you do you like in practice lay it out like that to a client?
Yeah, when
Politely.
I'm suggesting a scan, a lot of the times it's a lot more clear cut because they have a race.
Yeah.
And you're like, mate, you can't do this race if you've got this injury. It'll be very silly for you to go ahead and do it. Make sure it is not that, and then we can
Go
manage
from
it.
there.
Yeah,
Yeah.
exactly. And again, I always want to be wrong, but it's not always the case.
I love that though, and that's like we're very similar in our own sort of private practice with like being okay with being wrong and saying, I don't know, like let me get back to you.
I think it's just something that you have to like lean into as well.
Yeah.
We're never, and we've said this since the get go. You're never going to know everything at the time. Like you know, there's such a wide variety of different presentations that we see in practice. You know, like a lot of the time, you do have to kind of like sometimes get the clearance, or you know, make sure you are wrong and it's not something, so that you know they don't end up worse off for just going and doing the race.
Definitely. And I think like with the earlier bone stress, it's easy to be wrong because it kind of blends in.
Yeah.
They're more subtle symptoms. It's not clear.
Yeah.
I do enjoy the learning though as well.
Yeah.
Like it's again that kind of stakes of you have to kind of learn something and work something out to help this person. And it keeps you kind of accountable and keeps you pushing.
Yeah, for sure.
And I was just going to say, like, have you over your time found a bit of a generic kind of, and again, like we can't be super specific because everyone presents really differently, but like little signs and symptoms that you've noticed have popped up like in some of your presentations in practice?
Yeah. I think it's always going to be that more diffuse pain earlier on. And oftentimes it'll be prolonged, like when you overload a tendon, it'll be sore for a couple of hours and it'll generally start to die back. But it'll also only hurt when you load it versus when you overload a bone, it'll just be kind of diffusely sore the whole time. It will hurt more if you keep loading it, but that's probably the main thing that you pick up on. And then it's more like, can you poke the bone? Can you poke out the sore spot and really bring on their symptoms? And in places like the thigh and the hip, you can't poke it. So you actually have to do the opposite. You have to try and see if something else is accounting for their symptoms.
Right.
So like if someone's saying their thigh really hurts or their groin really hurts, you can't go in and poke their thigh bone. I wish you could. That'd be great. But that'd be cool. Yeah, that'd be cool. You'd get in trouble probably for cutting them open or something. But yeah, you have to actually just check other things.
Yeah.
And that's why it's hard.
Yeah.
Well, like a process of elimination of sorts.
Exactly, yeah. You want it to be their hip flexor or their quad muscle or their hamstring or their glute muscle, and then when it's not, then you have to kind of
Oh shit.
Rule it out now.
Yeah,
otherwise.
exactly.
Yeah, right. It might be a bit biased, I suppose, what with you working at a place called The Running Room. But what are the most common sort of sites that you see stress fractures in your clients?
It's in runners, it's always going to be majority tibial, like your shin bone.
Yep.
And then your like feet bones, your metatarsals. So
Do you see a lot of hip like stressies as well?
Yeah, we see a lot. I think one day we had 4 in the clinic,
Wow.
which is like unheard of. Those like the thigh bone, the femur is also pretty common. That's probably the next most. And unfortunately that one of the ones you can get in that area is really devastating. So even if I just suspect they have that, I won't actually do all the normal testing because it puts them at risk. Like getting them to jump and test it, I don't do. I just give them crutches and send them for a scan.
Yeah, right.
Just to really emphasize the risk with them, because oftentimes if you have a stress fracture in that area, even if you're on crutches for 6 weeks, the bone can actually progress and break more when you're not doing anything on it.
Right.
Yeah, so it's quite a high risk site.
Yeah, right.
And about 50% of people won't return to sport after that fracture. Yeah.
Do you ever break that stat?
I emphasize it to them if they're not going to be, if they're not going to listen.
Right.
Yeah. So I try to be as positive as I can in the situation because you don't want to scare the absolute daylights out of people. But in the patients that aren't going to listen to you, you just have to emphasize. So
Listen here.
Yeah, listen here. Like I'm trying to take care of you, basically.
Yeah, right.
Yeah.
Oh my God, 50%? That's wild.
Yeah, I think it's 45%, so I shouldn't round
Round
it down.
up.
Yeah, round up a
Add
little
a bit of something.
Yeah, a
pepper
bit of
into it,
pizzazz
right?
really gets those real difficult athletes
Yeah,
under
exactly.
control.
Wait, 90%? What are you talking about?
It works 90%, 50% of the time.
What's that off?
I have no idea. I
Oh,
think
it's
I think it's Anchorman or something.
I think it is Anchorman.
It's at least Will Ferrell, definitely.
Are you a Will Ferrell operator, Zeb?
I do like Will Ferrell. My favorite Will Ferrell movie is oh my God, Semi-Pro.
Oh,
never
yeah,
seen
of
that.
course, because
That's
you
just
love
'cause I love
basketball.
Oh,
yeah.
fair enough.
Kind of
Yeah,
cheating
fair
my
enough.
system.
Did
And
you-
Step Brothers.
Did you catch the finals, mate?
I did. I watched the finals. I was low-key a little bit sad just because I kind of didn't want the Celtics to win.
Oh, mate, you shouldn't say that to me. I'm
sorry, mate. Are you wearing
sitting
it?
here-
Are
I'm
you
wearing-
bleeding
Oh,
green?
no.
I'm bleeding green right now.
No, what have I done? I should have checked this before the show.
That's
No,
okay.
no. I low-key just would have really have liked Dallas in general to get a chip.
Yeah.
Although I'm really happy for the guys in the Celtics that they.
Well,
Yeah,
if you
nice
can walk
save,
it back
nice
now,
save.
yeah. You can
I'm
keep
trying to
moving
really
it.
rope it in here. So, there you go. Yeah, no,
You should have let him go on like longer, but
Yeah,
I
I was
should-
waiting for you to just like let me run and just be like, well, I'm walking out of here.
Yeah. I hate the Celtics. Screw those guys. Yeah. Just totally cuss them out.
Yeah. So that's my favorite Will Ferrell movie.
semi-pro.
Semi-pro.
What about yours?
Ooh, probably something like Interstellar because I'm just a nerd. Yeah.
Ooh. Oh, we're going favorite movies in general.
Oh, favorite
No,
Will Ferrell.
Yeah, Will Ferrell.
Yeah, Step Brothers.
I was like, I don't know who Will
I was
Ferrell
like, where was he in there?
Interstellar.
He might have been in the background or something.
He was just like a little orbit, like floating around. God,
He was the black hole. Yeah.
that's so funny.
Oh,
we love
so-
Will Ferrell.
Back to stress fractures.
Oh yeah.
Yeah. Real
Yeah.
serious again.
Yeah. Have you seen Will Ferrell's stress fracture? No, I'm kidding. So you mainly see though the shin, like kind of tibia stress fractures,
Yeah.
and metatarsal stress fractures. Like, is there anything in the research that kind of suggests why they're like the main sites for runners?
Just because like running is a really calf and
Yeah.
like ankle dominated sport. Like I don't think people always go, oh, like I've got weak glutes. That's why I'm slow. Your bum and your quads do very little during running. It's almost all calf. Like I think it's almost 60 to 80% of your propulsion is generated by just your calf muscles.
Yeah.
Yeah, right.
So you're loading your foot and your shin bone a lot. And then there's also just the impact like quality to running where you're just loading and landing a lot frequently.
Actually, that explains why Chapo's calves are so majestic.
They are
What about
great. I
friends?
don't know.
Do you
Have you
Chapo?
met Chapo?
No, I don't
He's
think
good
so.
friends
He
with
runs-
Izzy. He's does a lot of running stuff.
He runs in the eastern
amazing.
suburbs a lot. He loves.
I'm
it.
sure he's been into the clinic. I just probably don't know him as
Actually,
this chap.
It'd be he's friends with like Lydia and Sophie. Lydia, sorry,
Lydia,
and
yeah,
Sophie.
yeah,
Yeah.
yeah.
There you go. Well, yeah, he's got great calves.
He has amazing calves. When you said that, I was like, oh, that makes so much sense.
Cars are genetic as well, though. Like,
True.
definitely.
True.
My calves are just lackluster. Sad.
So how does a stress fracture, this is going to sound so daft, but I'm going to ask it anyway. How does a stress fracture differ from another, like a normal fracture?
Yeah. So generally, they like a traumatic fracture is essentially someone's come in or something's come in and or you've landed funny and the force is enough to just snap it along its weakest point.
Gotcha.
Versus a stress fracture is you're basically just beating it until it breaks.
Like prolonged.
It's very prolonged and
Yep.
slow. And generally that'll mean that more bone breaks down because it's not just going to be along that weakest point. It has to be basically everything around it.
Gotcha.
And also generally people that get stress fractures have other issues like about fueling and other components. So they just take way longer. It happened for a reason. If you don't address the reasons, it's much harder.
And this probably segues really nicely into the next segment.
What
but
are the reasons?
why? What are the common things that you really see in your presentations for why someone might be coming in with like a stress fracture?
Well, with the whole running boom, a lot of it is just load. People are it's super sexy to go and run. So they'll join a run club and they'll just start running a lot more.
They're the
and
new
then-
dating apps.
Exactly. Exactly. They're just trying to meet some boys and girls and they have to just do more and more runs to get that.
Yeah.
And then they'll be invited to do more runs
Yeah.
or they just want to be good at it. So they think that, I just have to get good really quickly. I have to run these Ks. People on Strava are doing this or people on Instagram are running this much. I need to get there.
Yeah.
And because there's pressure to like run fast, people will just run quick and run further and also just run more frequently very often. So they'll spike their load. Like I've had people come in and they're like, I run like 30 Ks a week. And I was like, what are we doing before? Like 5.
Yeah.
And they'll have done that in 2-3 weeks. So that's a really big spike in load. And that's most of what we see is going to be people just making silly mistakes. On the flip side, you'll have people that don't really make big mistakes. They'll make little ones. They'll change their shoes too drastically or they'll change the terrain that they're running on or they'll just increase their pace very slightly when they're running a lot already.
Right.
So that's kind of like the training load side that we see a lot of. Something that's a lot harder though is people that have like recovery problems. Like they're not eating enough or fueling enough or well enough. And that will just mean that they don't have the fuel to repair their bones. And that's where we get into like relative energy deficiency in sport, which is way more problematic and much more difficult to manage.
Yeah. Do you deal with that much?
Yeah, I would say probably a third of our patients are managing some extent of that, and a few of them have like eating disorders as you would be accustomed to managing often, or other like mental health and other issues along those lines.
Yeah, wow. And as well, like just knowledge lapse as well, right? Because that's a big thing. Like people just don't know the fact that you, like when your training load spikes, you need to eat more.
Yeah, exactly. Or they have difficulty eating because like running is hunger suppressing. Like exercise is hunger suppressing. They won't eat as much, or they can't eat before a run because they'll get sick.
It's always the case of like when they have a rest day, they're like, I'm so hungry. Why is that? I'm like, because your hunger is returning.
Yeah. Exactly. Exactly.
Please eat.
Or on the opposite side, they actually don't want to eat as much because running's the sexy new thing and they're trying to meet.
And they're like,
meet
this is going to make me fit. Like my cardio is going up. And
they're doing it as a weight loss journey.
The amount of carbs I ate when I'm like full in Mara prep is insane.
Yeah.
In a good way though. It's just like your body just needs them.
Exactly. I'm just running around with snakes in my pocket, man. Just having the best time.
I can empathize with the runner that doesn't want to eat before the run though, because I feel like stitch running is a big thing.
100%. 100%. I feel you hard.
Yeah,
man.
and when you're running at 4:30 in the morning, the last thing you want to do is get up and have a stitch while you're trying to run as well.
Was it Southern to Surf that you got a wicked stitch?
Yeah, I was like, Maddie, I have like vivid memories of like me like getting up the hill, slowing because I just had the biggest stitch ever, and then all of a sudden you would like run past me.
Yeah.
And then you would like get a stitch and I would run past you.
We were literally
we
like
were just
stitch
trading
tandems.
stitches.
Zeb would run past me and I'd be on the side of the road like
Just yo-yoing.
So bad.
I think stitches are the least of your worries if you've had something bad to eat on a run.
Oh, yeah.
Actually,
especially if you had a
talk about
pre-run coffee.
In our
Last
mate,
episode.
we had an IBS dietitian as one of our last guests, and Zeb recalled a story of him pooping his pants mid-run.
I know, I actually heard from, because we run down at URC, I spoke with the two people from the run club that can remember me like stopping to check my Apple Watch because it wasn't working very well, and I'd just gotten this brand new Apple Watch and they weren't Apple Watch fans, when really the real reason came out in the podcast. It's just like, I just needed to take a massive shit.
Mate, it's a rite of passage, honestly.
Absolutely.
The guts.
Oh my God.
If you haven't shit your pants, you're not running far enough.
Yeah. Are you actually a runner?
Are you a runner?
So it's either that sort of, I guess how it differentiates, just to come back to it, is like that immediate sort of fracture, or like you fall and break something.
Yeah.
Or that prolonged ignoring all the warning signs, and then it causes more damage.
Yeah, exactly.
And then the common kind of like predecessors being load management and then nutrition and fueling.
Yeah.
Like they're obviously two pretty big staples. I know you mentioned shoes.
Yeah.
I'm really interested to get your take on this because one, I wanna ask you about orthotics and what your thoughts are on them. And then two, I want to ask you about your running shoe recommendations.
Yeah.
And what that looks like from the perspective of how it sets up like a runner.
Yeah. Well, shoes themselves, there's no one type of shoe that's going to be best for mitigating like a bone stress injury. What you want to avoid is big changes. Same with like, there's no amount of load that's necessarily dangerous if you get used to it. But if you change it too quickly, you're going to be in trouble.
Yeah.
So if you run in like a pair of Kayanos, like Asics Kayanos, or New Balance 1080s, something like a really big rocket shoe, like a Hoka or something, and then you just go to like minimalist barefoot shoes.
Like the Nike Alpha Flyers or something.
No.
No,
Minimalist. So
like
no
Vivos.
cushion.
Yeah.
Barefoot
Like
shoes.
flats and things like that.
No cushion at all.
Gotcha.
Yeah, that's a really big change in terms of the loads that go through your foot and your shin.
Yep.
Like changing that when you're running 20, 30, 40, 50 Ks a week is a very, very big change. So that transition period is really dangerous.
And what about the swing, the opposite way? Because I saw like things popping up here and there about loading patterns and like different areas getting loaded when you change from like a minimalist shoe to a max cushion shoe, or a max cushion shoe to a minimalist shoe.
Yeah.
Like, is there much to say that like the opposite as well?
Well, increasing, going to a maximalist shoe will generally reduce the load at the shin and the feet, which is going to be where the majority of the bone stress injuries happen. But it can increase a lot the force through your knee. And that's just because they're generally higher at the back.
heel.
So it's kind of like if you do squats and you elevate your heel, your knees will go further forward. You'll load your knee more.
Yep.
If you're running and your knees are going further forward, then you'll load them more.
Yeah. It almost unintentionally changes your running technique a little bit as well.
You can't really get rid of load. You have to just put it somewhere else.
Yeah.
Right.
Yeah.
But if you want to change to a more of a barefoot shoe, if you're starting in the, what are they called? The rocker shoes.
Yeah.
Is it best to alternate sort of your runs with each shoe to sort of slowly transition, or what does that look like?
Yeah, you really need to be spending kind of like 8 to 12 weeks or more kind of transitioning if you're running a fair amount or doing a fair amount in like maximalist shoes.
Yep.
And that would just be, you pick 5Ks that you're going to do in your barefoot shoes, or you just start walking actually more in your barefoot shoes, and then you pick 5Ks. And then you bump that up to 10, and then you bump it up slowly. And you might get through that and be like, oh, my feet are getting sore. And then you'll have to dial back and go even slower.
Right.
So there's no like one size fits all, but you have to be slow.
Yeah.
Can't be a rapid change.
Slow is good. Don't buy shoes the day before the marathon.
Yeah, you know.
Oh, so dumb.
I need to see that picture of your foot.
Oh,
later.
I have to show you. Oh, it's
We might
horrendous.
flash it on the screen.
Yeah,
We'll send it to Kenny and get it flashed on the screen.
I was going to say, I
So
can't even
people
jump
put it
scare.
up.
Trauma warning.
Yeah.
Yeah, it'll have to. What's the thing on Instagram when it's something graphic and you have to like give permission to view it? It'll have to have that.
Yeah,
pretty
true.
bad.
Maybe we won't flash it mid
Maybe
episode.
we won't.
Yeah, it might get pulled down.
Yeah, it might get done.
Cool. Well, that's step one. What's your take on orthotics?
Yes.
That's question number 2.
Orthotics as a whole, I'm not a huge fan on
Yep.
because I think they get overprescribed and people get stuck in them and they don't think they can get out of them.
Yeah.
And I think a lot of the time it's kind of maybe not ill-intentioned, but it's kind of a bit of a money grab for some for some practitioners. Not always. I think there's definitely a place for them in bone stress injuries because you can shift the load around really well. If someone's broken part of their foot because they're loading it too much and you give them an orthotic that has an arch support and distributes the weight better and has some cushioning and or a slight tilt to the orthotic to shift the weight, that can be really helpful. I think that's really powerful.
Yeah, and also helpful for symptom modification, like load reduction, but then also out from that helps them train or strengthen in the perspective where then they can almost get back to running without the orthotic. Is that like your kind of mindset or your take on it?
My take is always like, what's the priority? If they just want to get back quicker and run further, then the orthotic might be something they keep for a long time.
Yeah.
If their goal is just to get back to doing things more, I may not even give them an orthotic.
Yeah.
Because if they are wearing an orthotic and they want to get rid of it and they get back up to running like 100 Ks a week, it's going to take them a long time to wean out of that. Yeah.
Especially depending on how long they've actually had the orthotic for, right? Because I find you often see like kids getting prescribed orthotics straight away from the get-go when they're, they haven't even gone through like a growth phase or anything like that. And they're just,
they have
like,
flat feet.
I'm in orthotics for my life. Like that's their mindset almost. And you think about the implications of being in an orthotic for that long and then just not feeling like you can get out of it and not doing anything to get out of it.
I was one of those kids. I got given them when I was like 14, and every time I would take, because I had bad knee pain, every time I'd take the orthotic out, I'd just get knee pain again.
Yeah.
You know what I mean? And I just didn't understand you had to wean them, like do it gradually. But it took like probably 3 months to wean out of the orthotic, but as a 24-year-old.
But without that knowledge, you probably just think you're confined to them your whole life.
Oh, 100%.
Yeah. That's hard.
I always find orthotics really controversial. I get patients that come in and I'm like, why do you have that?
Yes.
I wonder what the purpose was. Like, I really want to know, like, why did you go and see that, like, the person who gave you the orthotic in the first place? Did you even have any pain, or was it just something that they gave to you?
I can imagine you asking, but like trying not to be judgmental, being like, "Oh, cool." Like, why?
But I'm the same. Like, I think they do have a purpose. Like, I'm all for them if there's symptoms like presenting that can be modified by using the orthotic in the interim or in the short term or in the however long needs to be used. But I don't know. I just get so like about it.
Oh yeah, I think we kind of can swing the pendulum, right? Like it's being overused, and now we just hate them.
Yeah,
and there's probably some area in the middle where they're like we're talking about, but it's just hard. Like,
it's so hard, and like you said as well, it's case by case. You're never gonna there's gonna be people that they're just really suited for, and people as well, because I think we always come from the perspective that there's people in the world that want to get better and want to do the best thing for their body, and they're happy to work at it and really chip away at it. But then there's also the opposite. There's people that just don't want that.
No,
they
I'm
just want to
good.
be able to run pain-free, and they don't want to have to do any extra work.
You just have to not treat the runner, treat the person in front of you.
treat the
right?
person in
Yeah.
front of you.
So hypothetically, Zeb is doing the Sydney Marathon, coming off the back rather of a stress fracture.
Yeah.
How, obviously this is again so case by case, but more generally, how would you go about like treating pain and minimizing that for him?
Or not even treating it, like what would you consider, like from my training perspective, I suppose.
From your training perspective, do you mean?
Complex question.
Yeah,
It is. That is really. We've gone complex, but
That's
let's
More
just
of
roll
like,
with it.
That's okay.
Like he's training and you have to do a certain level of training, obviously, but like what would you recommend in terms of like rest and activity sort of modification, I suppose?
Yeah, so it depends on how bad the bone stress injury is, but essentially if you're doing an activity and it's painful and you have a low risk, not bad stress fracture, you still have to not do it, because if there's pain, it's indicative that the bone is breaking down. And as we mentioned, like if the bone is being broken down, it'll break down quicker, and also it's going to take a long time to recover.
Yeah.
So the immediate management is like aggressive rest so that things aren't painful. And once you've done some aggressive offloading and there's some healing, you can start to reload them. How you reload them depends on a multitude of factors. If they have bone health issues or like metabolic and hormonal health issues, you have to go really slow,
Yeah.
because no matter what, I can't physio away under fueling.
Yeah.
Do you know what I mean? And you can't physio away like poor hormonal health or poor bone health. It takes time. If they don't have those things, it can be really quick. I've gotten someone to running a marathon, 100 Ks a week in 4 months or something after a bad stress fracture. So
Off the back of like nothing.
off the back of running a lot.
Right.
Yeah.
Gotcha.
But like you can get up to really high volumes if you're a good runner really quickly off of a stress fracture if you manage it well.
Yeah, right.
Yeah.
And again, like obviously, so like case by case, I feel like we've said that a gazillion times, but it's true.
Yeah.
Generally, if it's not too bad of a stress fracture, what's the rest time?
Oh, it'll be 1 or 2 weeks of like potentially a boot if they have some symptoms walking around.
Yep.
And then it will be 2, 3, 4, 5 weeks of reloading and then back to running.
Yeah,
But
right.
it's pretty slow, small amounts of running that builds up.
Yeah.
Yeah.
And I think this is a really common thing people don't understand as well. We manage stress fractures or stress reactions like we manage a fracture of some sort as well.
Yeah.
Because at the end of the day, like you said, the bone is breaking down. You need to really be aggressive with it. You
Yeah.
Really
can't
gonna
just be like,
escalate.
yeah, you say to people, oh, we're going to like drop your load,
Yeah.
or like we'll be aggressive with it. They think, oh yeah, that's great. I can still, go out and walk like
Yeah, they'll
K's and K's, and I can walk around at work, and I can walk around at this, and
Or the
everything's
people
gonna
that
be
are like,
fine.
oh, I'm not exercising, but I am like doing 10,000 steps a day. So I'm like, that is still exercise.
Yeah, exactly. Or they'll be in a boot and they'll do 12,000 steps in that day and their foot's still hurting and you're like, that's not the whole point of the boot is so you don't overload it.
Bed
Yeah.
rest.
Yeah.
And so to give a really good context to that, I think like aggressive rest for, let's say, like severe severe tibial stress reaction or severe like metatarsal stress reaction. What are you looking in terms of time frame to like sit them for if it's like on the severe end?
If it's severe, it can be up to kind of 6 weeks in a boot.
Yeah.
Yeah. And depends on where it is. Sometimes you actually have to go 12 weeks on crutches.
Yeah.
Wow.
So it really depends on the size. Sorry, I keep saying this. Yes. But if it's just like a low risk bone stress injury to their tibia or metatarsals,
Yep.
then they'll only sometimes be in a boot for 2 weeks. Again,
Yeah, right.
they can go really quickly. It depends on how well they recover.
You just got to adhere to the whole rest thing.
Yeah.
Yeah.
Try and like loophole it.
Exactly. As soon as you start to overload them and they're already breaking down, it can happen so quickly. Like I've had patients that have done 100K week and then they'll finish that. They'll have the tiniest bit of shin pain and they'll go for a 5K run a couple days later and they won't be able to finish it. They'll get 2Ks in because their shin is seriously sore. Their foot is seriously sore and they can't run anymore.
Yeah, right.
So it can turn around really quickly, and that's the risk you're running. It's better to be conservative in these because they're just so problematic.
Yeah, and we've obviously touched on the importance of like recovery and nutrition with that. What about sleep? Does sleep play a role?
Yeah, sleep's massive. I was speaking about this with someone recently. You don't get better when you're training. Like if you've ever been to the gym and you go do your first set of an exercise, by the time you finish the gym, you can't go back and lift the same weight. Like you only get weaker during the gym because you're pushing yourself hard.
Yeah.
You only get weaker and worse at running when you're training. Your bones and everything, they're healing and recovering when you're sleeping and resting. So there was a study done in, I think it was the Israeli army, and they actually reduced the incidence of stress fractures in their military personnel by 80% by increasing their sleep by like 1.5 hours and reducing their marching a bit.
Oh my God.
Yeah, so sleep's massive. Sleep's very key in promoting bone health.
Which is so hard to juggle when you're working full time, living a normal life, and maybe training for an event that's coming up as well. Like I remember when I was peak marathon prep, I think I was like averaging like 6 hours, which is so bad. Like definitely not practicing what I preach, but it was impossible.
Yeah.
And it is hard. And I think we spoke to Izzy about this the other week as well, those low-hanging fruits of nutrition, sleep, and like exercise being the key kind of foundations of setting up
And non-sexy things.
Yeah.
It's not the ice baths. It's not
No.
It's not
as
the
much as the
breath work.
recovery stuff does, like play a bit of a role. Like at the end of the day, it comes down to those things. If you're not getting sleep, if your stress levels are high, if you're not eating well,
Pull up a blankie, chuck on an eye mask, go to sleep.
Yeah, definitely. Like you can't out-train poor recovery.
Yeah.
If you're going to go do a 20K run and you're just not sleeping well, you're probably not going to get much out of that 20K run.
Yeah.
Yeah.
No, that's good to know though. And again, it's often so overlooked, right? Like, oh yeah, sleep. Like everyone should get more of that. But in this case, like, it's so pivotal.
Oh yeah, I will spend almost a whole session just explaining like you need to be fueling, you need to be sleeping, you need to be not pushing your exercise in all these other areas when you're recovering from a bone stress injury. And that's hard. Like a lot of people, if they admit it or not, like have issues with putting on weight or have issues with like mental health that they're coping with exercise. Like running is very common to have some of those things going on.
For sure.
And that's like a battle that they're going to have to face, ideally not alone. Like we'll get a sports dietitian involved or a sports doc or a sports psych involved. Yeah.
So hard, particularly, I forget what episode we talked about it, but when it's your only coping mechanism, it becomes really problematic.
Yeah.
Yeah.
And often they do running because they don't enjoy the gym or they don't enjoy something else. And it's about like supporting them to find other things to do that will be productive.
Yeah. It might not have the same effect, but at least it's something.
Yeah.
Yeah. It is hard.
How much do you guys focus on biomechanics and like running form? Quotation marks.
We do a lot of like running technique assessment, but oftentimes there's not that many things that matter drastically. Biomechanics are very much overplayed in most of healthcare because the body's really adaptable. You can get used to so many different things. I think with bones, that's probably a situation where there is some obvious things you can change because we've got good research in it, and also bones are very much like a biomechanically stressed tissue. So we will look a lot at how someone runs when you've got a bone stress injury, just so we can tick a few small boxes to make sure it's less.
Can you retrain someone that has a wonky running style? As someone who does think that they have a wonky running style.
You can train it. Like you can train it quite easily with a few different things. The question is, do you need to? And most of the time, the answer is no.
Yeah, unless you're going for performance, right?
Yeah, there are a few things that you can change for performance, but even then, a lot of them, you can get away with doing lots of things and still be really fast. Yeah. If you've seen some of the marathon runners, like the world record marathon runners, most of them don't run exactly the same.
Yeah.
Actually, Luke did a breakdown of that. Luke from Evolve Human Performance. He's an EP. On S&C.
Yeah, an S&C.
But he broke it down. I was like one of the fastest guys doing some marathon, and he was like, this guy has like a bad running style by the book, but like he's obviously not a bad runner.
No, he's dominating.
Yeah.
And there's so many factors that go into how you run. Like people are built differently. Not all of us have the same skeletal structure. Not all of us have the same muscle structure. And then also like how you learn to run and how you work out as to be efficient is totally different, dependent on lots of different things. So your body will work out what works, and you can sometimes just let it do that.
Yeah, cool. As long as you're not in pain, that's good.
Yeah, as soon as pain starts getting involved and injury gets involved, it's a lot harder.
Yeah.
Because the body is so bad at adapting to those things.
Yeah. I find... Oh, sorry, you go.
No, you go.
Oh, I was going to say, I just find it so interesting how everyone's so different running style. Like, I distinctly remember when we used to do peak URC days, and it's like 4:30 in the morning, so it's pitch black. But people in front of you would be like, oh, Mads, I know that was you coming up. Like I could hear in the like sound of how your feet were hitting the pavement.
Yeah.
It's like, how did you know? Like it's just wild to me. I don't know.
Yeah, that's cool.
Yeah. I feel like I really want to touch on like a bit of a preventative perspective here as well, and give some people like good takeaway from the perspective of running season's coming up. I want them to be able to kind of get something tangible in their own running journey. When people are like starting out, do you have people that come to you and go, what should I, like, with my training, what should I be looking at from like a training load perspective
to get up to for a marathon?
Yeah.
Yeah.
Or let's just say, like even if it's a half marathon or something smaller to start with, where do you start with people? Because I think it's really hard to contextualize, and obviously, again, everyone's different. We're going to keep saying that over and over again.
Case by case.
Case by case. But like, are there some staples that you would dish out to people in terms of like some starting blocks?
Yeah. Well, I think it's always important whenever we look at where to start someone is what they have done in the past and where they're trying to get to. If you're trying to do a half marathon, a lot of people can get away with only running 12 to 15 Ks before doing a half. So you don't actually need to get up to running 20 Ks to be prepared for it. And that's really awesome because it gives you a lot more time and flexibility, and you don't need to be as stressed about getting it done. And I think understanding that's important. The second thing would be if this person has never run before, but they've played rugby or basketball or netball or soccer or AFL and just played other sports, they'll have like this background resiliency and they'll be able to run a lot more because they actually have done some running in that sport. Yeah. Versus if someone hasn't done those things, they've been mostly sedentary in their whole life, you have to start small. And I think on the other side, if they've done a lot of strength training and other resistance training, they'll be a bit more resilient.
And this is something we spoke about in an earlier episode, but what's your take on the use of strength training in runners? Because I feel like a lot of people start running and go, oh, I just need to run. Like, I don't need to do anything strength orientated.
Slow me down.
I'll just get
too
bulky.
much. Yeah. I'll just do 5 runs a week and I'll be fine. I'll get to my marrow there.
Yeah. So the evidence for strength training to improve performance is really it's really easy. It's really obvious. So it can improve your efficiency very drastically and very quickly if you just do some heavy strength training or do some like plyometrics, some jumping based exercises. You can improve running economy by like 8 to 12% just doing a bit of strength training and jumps.
Oh, wow.
Yeah. So it's huge. It's massive. And beyond that, the evidence for it preventing injuries is just bad. The studies suck. Yeah. But the few good studies that are out there show you can reduce running injuries by 30 to 80%.
Yeah. We love substantiating claims.
Yeah, exactly. So I'm nitpicking the studies, but my bias is that strength training is awesome for performance. You should do it just because of that. Yeah. And then if it does really reduce the risk of injuries, you should definitely do it.
Yeah. I think in my own personal experience, it definitely reduces the risk.
Yeah. Well, it's hard for people to contextualize as well because they look at the sport-specific nature of it and they go, oh, like lifting weights in a gym isn't going to translate out to running, a heap of Ks. Yeah. And you're kind of like, well, how are you going to run those Ks if you don't have any tissue capacity? Or
Dude, if you're weak as hell and I ask you to carry your own body weight up a hill, you'll be exhausted. Yeah. If you're stronger, or just average, it'll be easy to walk up the hill. Yeah. If you're even stronger, each rep is easier each step is easier for your muscles. And that just means that it's not as hard to run.
Yeah.
Yeah.
Actually, that makes a lot of sense. Our next question might be a little bit hard to capture, I suppose, but do you predominantly see males or females or a bit of an even mix?
It depends really on the injury because different populations get different injuries. But we kind of
fractures.
Yeah, in stress fractures, different stress fractures happen differently in each gender.
Yeah.
But primarily, I think we've got a fairly even split, maybe more females, because females generally will get 2 times the rate of bone stress injuries.
Right.
But I think the issue is I think more men do running than females, so it kind of ends up balancing out the population when we see them. And I also think oftentimes I think a lot of the females end up being better at taking care of themselves.
Yeah, it's the whole women are more likely to seek help sort of thing as well.
Yeah, men can be so dumb.
Yeah.
Honestly, so dumb. Well, I've had a bone stress injury, so I can say that.
So
yeah.
Is the double rate is it obviously it might be a convoluted answer, but related to hormones and things like that?
Yeah. So there's some recent studies coming out now that females are just a bit more susceptible to hormonal changes with low energy availability.
Yep.
So not getting enough fuel basically, or training too much. But females also generally have less robust skeleton, whether that is hormonal based or just lifestyle based and things like that. And females also load their bones more than males do, for a number of reasons.
Yep.
I think something that's important to note is though, doing change of direction sports and doing strength training improves your bone health a lot, and improves your robustness in general a lot. And generally we see like participation rates, like how much girls play sports when they're younger is much lower.
Yeah.
And also the pressures that they face to fuel and be a certain, like look a certain way is very different. So unfortunately, like there's heaps of reasons why females get the brunt of the bone stress injuries. Not all of them are particularly biomechanical or medical focused.
Yeah, so many different like avenues. Yeah, it's hard.
Yeah. Can't prevent all those things either. That's the real problem.
No. It's as with anything with health though, it's like so multifactorial. What did I say once? Fractal, not a word.
It's
Hey,
not a word.
Let's add it. Fractal.
Yeah, we looked for it.
I
We
said
looked
it
for
with
the word
such
fractal, but
confidence too. I was like,
she's
you
like, that's a
fucking
word, isn't it?
idiot.
Fractal?
It's a hat brand.
Yeah,
It is, yeah.
Fractal running.
That's where we think she saw it and just like,
She just took it and
applied
ran.
to
Yeah,
them two
just
together.
adopted it and
Yeah.
giving a word a new meaning. Oh, this has been such a good chat though. And again, obviously, as we said off air, we just wanted to cover the basics before maybe diving down into the nitty gritty later on. But I do feel like a lot of people would have gotten a lot, as you said, coming up into running season as well.
Yep. We're about to hit peak back end
Yeah,
of
by the
year
time
running.
this app comes out, hey.
Yeah, Southo to Surf will have already been. Have you ever run Southo to Surf?
No, I don't want to.
Oh, it's a
I
great
think
run.
City to Surf will be about to or would have just passed.
Just about. And then
Yeah.
Sydney will be the next one on the cards that I think a lot of people are angling.
Yeah, it's already sold out so quickly this year.
It did.
And it was up 200% in terms of participation last year
Year
compared to the
before,
year
yeah.
before. Yeah.
Wow.
So,
Yeah, and I think even because I'm from Melbourne, the Nike Mara's like pretty much at capacity as well now.
yeah,
They're
and that's
doing-
in October.
I
Like,
think they're doing ballots for like the half marathon at the minute.
yeah, and
They're actually doing like progressive releases, and you have to like get a deposit in for a spot, and then if you get it, you get it. If you don't, they give you money.
Oh my God.
Yeah.
I mean, I do like that everyone's running. It obviously, like, there is a fine line between it being good and, you know, harmful. But, like, you know, it's a good social outing, better than sitting in the pub if that's not your thing.
Yeah. I
Yeah.
think as well, just like something like these days we're finding that like activity plays such a crucial role in everyone's life or most people's lives to some capacity, whether it's going for a walk along the beach or like running a marathon if you're crazy enough to try it. But it's really nice to see like a lot of people taking a big interest in it, and you know I think it's only going to grow, keep growing. More people on the earth anyway, so
yeah.
True.
so only ever going to go up in terms of numbers.
I know. Well, look, if anyone listening wants to find out a little bit more about you or even work with you if they are based around the eastern suburbs of Sydney, where can they find you?
You can find me on socials as the Stress Fracture Physio or just Stress Fracture Physio. And then I work in Clovelly at the running room. Like,
Amazing.
yeah, we just see runners almost. So
Nice.
if you are running and you get hurt, we'll know what to
Come
do.
see Beau. We'll
Yeah.
pop all these in the show notes as well.
Okay, yes, sweet. Thank you.
Yeah, amazing. Well, thanks so much for having. Let me start that again. God, fuck.
Right at the end, right at the
Ah,
end. We
okay.
did so well.
I
Oh.
know. Only one fuck up. You go.
Thanks so much for coming. Thanks so much for coming on today, though. It's been awesome to have you out to the studio in the lovely grey creative studio.
I know, it's great.
Amazing.
Unreal.
It's great.
Yeah, which is
insane.
cool. So we're very lucky to have you out here, and yeah, we look forward to popping this episode up.
Yeah, thank you so much for having me, guys. I love chatting bones. You guys are so cool as well. This is such a great space.
Also,
love
I
it.
realized halfway through the app that you have the Hulk socks on, and I am loving it. It's
Oh,
so
yeah.
good. Oh, that's why I was looking down. I was like, man, they're cool.
Oh, mate, I should have been rocking the LSKD socks, man. Yeah.
Next time.
Yeah.
Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at we don't know yet.pod.
See ya.